is the Senior Dog Summit pre-launch kickoff party. I have collected here a set of distinguished veterinarians, therapists, educators, speakers, and we're going to have some fun tonight. So I'm going to introduce each one of our guest speakers, and then we'll get on to the program. I'm going to start with Will Falconer. And we were actually classmates in vet school. So we spent 4 years huddled together in classes and going out together. So I really appreciate him being part of this. And he started out in conventional veterinary practice in 1980, using all the latest drugs and surgeries. After 7 years, he followed an inspiration that led to holistic retraining and finally to his full-time homeopathic practice, treating animals globally without drugs. His goal is wildly healthy animals with natural disease resistance and confident owners who call the shots for their animals. Dr. Falconer uses nature to inspire and guide his work and educational efforts. Also with us tonight is Dr. Pj Broadfoot. She started her own practice in Van Buren, Arkansas in 1982 and developed an interest in complementary medicine with a very diverse and eclectic collection of therapeutics. She sits on the board of many organizations, including the Registration of Alternative and Integrative Veterinary Education. She has lectured internationally and co-authored books to help educate pet parents around the world. Her current focus is on promoting wellness in pets. Next is Dr. Amy Hayek. Now, Amy I've known via the chiropractic world. We're both members of the American Veterinary Chiropractic Association. And that is one of Amy's certifications and her postdoctoral training. She also has postdoctoral training in acupuncture, advanced neurology, and nutrition as it relates to environmental effects on animals. Amy trains animal chiropractors and animal owners to understand that animals, like us, are always in tune with the environment. And she likes to help point out that many animal owners don't realize their animals are self-healing, but they and we are. Next is Laurie Edge-Hughes. Laurie is a physical therapist from Canada. She has a master's degree in animal physiotherapy and certifications in canine rehabilitation and acupuncture. She taught the first courses in canine physical therapy, I get this, in Canada, the USA, and Australia, and is sought after as an instructor on this subject worldwide. She owns and practices out of the Canine Fitness Center in Calgary, Canada. So I welcome all of you here with us tonight.
Glad
Great to be here.
Thank you so much.
Yeah. All righty. So the Senior Pet Summit, we're focusing on those older to aging geriatric dogs and keeping up with them throughout those transition of years really requires some diligence on the part of the owner because there's so many turns and kinks and places where things could go wrong, and also that accumulation of whatever they've got on them from all of their years. So with that in mind, each of you have been selected to be a part of this program, and I'll take each of you one at a time, and I want you to give us a little bit of information about the topic that you're going to be sharing with us during the summit. So Dr. Will, we'll start with you.
All right. Well, I've been asked to talk about inflammation. And first and foremost, I want everyone to know that inflammation is natural. You know, we tend to think of it as the bad guy, and you see these shopping aisles down the grocery store that are full of anti-inflammatory drugs, but we'd be lost without inflammation. Inflammation is part of nature's book of tricks to help us heal when we need to heal from acute injury or acute disease like parvo. Inflammation comes in and knits things back together. So that's a really important thing to realize. And whether you're injured or your dog is injured, you want inflammation to help you heal it. We recognize it by its fourfold symptom pattern. There's heat, there's pain, there's redness, and there's swelling. Some combination of those things will tell us, inflammation is going on. Those aches after a flu, that's inflammation. The red swollen ear that your dog's got from an allergy, that's inflammation. And we all do this in acute situations to heal. But what we're not wanting and what we see all too often is called chronic inflammation. And don't let that word scare you. It just means it's stretched out over time, right? Instead of acute, which is fixed and short, and you expect it to be done in days or at most a week, chronic means it can go on for weeks or months. That's what we are not wanting. And that's what gets often tagged with the itis word, right? So arthritis is chronic sore joints, and dermatitis is this itchy inflamed skin, and otitis are these horrible ears that hurt and stink often, and they're painful, they're swollen. Enteritis, hepatitis, and encephalitis, etc. So we can get it in any part of our bodies, as can our dogs. So when you hear that itis word coming up from your vet, that's what they're talking about. You've got some inflammation going on in your dog. Well, the thing I want to take everybody through is that chronic inflammation is man-made. It doesn't happen in the wild ancestors. That's how we know it's man-made. So it turns out that the wolf is your dog's closest relative. 99% genetic overlap in the mitochondrial DNA between these two species. And do we ever see a limping wolf in the wild? Briefly, maybe, but not aged and limping because of chronic inflammation. That's not reality for the wolf. Do we ever see chronically inflamed skin where these wolves are just itching and, beating their coat out with their hind paws and, miserable all the time? No, they could have an acute dermatitis, but they'll get over it and not be expected to go on for weeks or months. Similar with ears. You'll never see a wolf with a chronic head tilt who's digging in that ear and it hurts because it's so inflamed. He's allergic to something. That's all man-made stuff. So the norm in nature is to suffer some of these things acutely, short term, but not to go on and on. So how do we create this chronic inflammation? How does man create this chronic inflammation? The three main things I come back to over and over again are first, vaccines, which can create allergies. We've followed that for years now. Often a month after a round of vaccines, somebody starts itching their feet or scratching their ears. Very, very common. It's not on the immediate heels of a vaccine, but look out a little bit down the road, you'll see it. And autoimmune disease is another sequela or aftermath of vaccination, and that's the more deadly one. That can come on within 48 hours of getting a vaccine. Luckily, we don't see it too often, but that's where the body attacks self. Now it takes out red blood cells, which you need to live, or platelets, which you, of course, need to clot your blood. So that's the big, probably number one cause is we over-vaccinate. Some of our colleagues vaccinate, 40% of them were claimed to have vaccinated yearly in their practice, which is a baseless practice, no science behind it at all. The second is poor quality food. So let's contrast the wolf and the dog. The wolf is eating what? One thing, it's prey. And they're on the go for it, which we'll come to a little bit later, but they're eating fresh, raw, warm prey. Hasn't gone through a campfire first, hasn't been made into a little food-like particle by science, right? It's prey. Very, very different from kibble. And the third thing we do to our animals is we probably unknowingly poison them with pesticides, whether it's for fleas or ticks or heartworm. Those classes of medicines are all pesticides. So the longer these things are in use, the more likely you are to create a chronically inflamed state. A glaring example is allergic skin disease. All those symptoms come about from a wild over-response to normal things. Dogs live in the world. They could take a bite of chicken as a normal course, as would a wolf eat a bird off its nest if he could get it. But the allergic dog is wildly overreacting to that and now breaking out in skin disease or ear disease, otitis. I call this immune confusion. A grass or a pollen could do the same thing. You have a shopping list oftentimes of how many things your dog is allergic to. That's all man-made. Cranial cruciate ligament injuries is another one. We tend to think, oh, that just happened because Bowser stepped in a hole. No, the scientists have shown us that there's inflammation against that ligament for time before the injury ever took place. So we've created this and we can undo it or we can avoid it. So how to avoid it? We'll want to minimize or intelligently avoid altogether vaccines. And by that, I don't mean just do nothing against infectious disease, but intelligently avoid it like my students do. And we can choose a raw balanced diet. These are available in many forms now. They're frozen, they're out there on the market. You can find recipes to make it balanced yourself. And we'll get much closer to prey with that than we ever would with a kibble, which is so highly processed and heat denatured that it's nothing like real food for a dog. And we can find alternatives to keep the fleas away. The best, by the way, the number one best way to do that is to have a super healthy dog. I've seen this over and over again. They actually repel the fleas and the ticks. The fleas jump on, they go, oh, no, this isn't a host I want to stay with. Let's get out of here and go find somebody who's weakened. So that happens regularly. And we want to start from puppyhood because, as Ava said, it's an accumulation of things, right, over time. But even if you haven't started from puppyhood, start now to shape these things in your dog so that you're building better and better health as you go. So that's it.
Will. We appreciate that as a snippet and intro to what's going to be ahead.
Hey,
All
Ava,
right. Uh-huh.
can I ask Will a question?
Sure, I guess so. I don't know. This is our intro part. Unfortunately, they can cut and paste along in here.
I know.
So
But I wanted to
I've been
know
doing a
about,
little bit of intro about there. So you can
Right.
ask a question just to get your answer and then, yeah.
I just want to know about chupacabra. What do you think of our,
I don't know chupacabra at all.
in
live in
Texas,
South
they talk
America?
about them all the
Oh.
time.
Uh-huh.
They are thought to be the coyotes that have, some kind of mange infestation or something like that.
Yeah, no knowledge.
Okay.
He's been
Maybe
in
genetic.
India for a while.
Well, even when I was in Texas, I think I barely heard about them, but maybe some genetic defect. I don't know. Maybe they're inbred. They're so small
Inbred.
numbers.
Yeah. My theory was that they were, probably too close to urban areas. So they're not
Possibly,
really eating their natural food.
Yeah, sure. That makes sense.
All righty. So we will continue on. Next is Dr. Pj Broadfoot. Pj, if you want to give us a snippet of what you're going to be sharing with us during the Senior Pet Summit.
Well, my topic was dental disease or oral disease, along with weight issues, which is a huge factor. It's probably one of the number one issues in chronic degenerative diseases because the health of the body actually starts in the mouth, and you start and part of that goes back to what Will was talking about: diets, fresh foods. That you don't see those kinds of gacky mouths in patients or in wild animals that eat prey, that prehend their food, that eat raw bones and keep their mouths clean. So but it's a critical.
PJ,
Yes,
let me interrupt. Your mic is rattling something. Yeah,
Okay.
it's making some noise. So I don't know if it's against you or
Yeah,
the
maybe.
cord is
try and-
hitting something.
Thank you. I think
Thank
that
you.
I've had that problem before. Thanks for that observation.
Okay.
Because it's distracting to somebody. I can't hear it. So
Ah,
so the point being that's generally a biofilm issue. So once the bacteria kind of get a foothold in the mouth, they create themselves a nice little gated community in there, and that's what ends up being the plaque. So every time that you chew, your animals chew, they move the bacteria from that plaque and they distribute it. You think about it, the lymphatic system that drains the mouth drops directly into the heart. And then the heart just takes it everywhere. So it's a big factor in chronic inflammatory systemic diseases. And it's probably a major factor in how biofilm gets distributed throughout the body, particularly cardiac stuff. So one of the reasons that we see so many problems in the aged patients. So there again, that's one of those issues where it's far better to prevent the problem than it is to try and play catch up. And I have grown up actually with a horror of anesthesia. I don't know how I ended up being a veterinarian sometimes, but my mother was charge nurse in recovery for about 50 years, so I used to hear all the horrible post-surgical stories. And my dad, who was a cardiologist, absolutely refused to go under anesthesia. So that kind of colored my perception of anesthetic, I think. But it's not benign, and some of these animals come in and they're getting dentals. I've had patients in my practice that have had dentals every 6 months to a year, and they still have terrible teeth because the good fresh food is not probiotic rich. I mean, there is a microbiome in the mouth that should be balanced, and part of that is balanced by species appropriate foods, and some of it's by abrasion, but a lot of it has to do with diet. Now when patients come in when they're puppies, we try and talk them into doing raw meaty bones, and so they get good natural chew, because they say, well, they're eating rawhides, not a lot of those have formaldehyde for one thing, and they don't get enough abrasion to actually clean their mouth. And we've been doing this long enough that I have some like 7 and 8 year old Yorkies that traditionally have dragon mouth by the time they're 2 or 3, and we've got some 7 and 8 year old mouths that are beautiful. So, and then there's, once you get to the point where you do have we do a lot of preemptive stuff to try and get, and there's many things you can do to try and clean up the mouth a little bit. Some enzymatic stuff, zeolites, things that tie up the metals in the biofilm. And even though a lot of times the plaque is still there, surprisingly enough, the gingival stuff is a lot better. And you can reduce or revert the periodontal or the gingivitis. Once they've got periodontal disease, you're looking at chronic inflammation. It's that inflammatory thing that becomes an ongoing issue for the patient, and it's often what starts that the microbiome shifts all the way through the gut. So leaky gut starts in the mouth, basically. So those are things that we're going to talk about in a little more detail in the interviews later.
Thank you, PJ. And next we have Dr. Amy. Your topic was chiropractic. So share with us some of what share with us what some of the pet parents then will be able to see in the presentation that you'll be doing on chiropractic.
Thank you, Ava. I have to say, I'm really glad you chose me for chiropractic, because that's really near and dear to my heart. And it definitely is one of those things that I think a lot of pet parents don't know enough about. I think that chiropractic in general is starting to gather more hold in veterinary clinics. We're starting to see more veterinarians who want to take the course and learn what chiropractic can actually do for their patients. But one of the things that we see just in broadly in the public, in the media, in the popular media, is that we don't hear anything about how chiropractic can actually help people or their animals. We hear so much more from the allopathic medicine or the drug companies about what they can do for X, Y, and Z illnesses. So in my talk, we're going to talk a little bit about how chiropractic works. We're going to talk a little bit more about the the idea of chiropractic, because I think it's kind of an ethereal thing for people. People come in and they say, I want my dog cracked, you know, because they hear the noise. I mean, when people get adjusted, they oftentimes make lots of loud noises in the chiropractor's office. A big part of that comes from the fact that people in general are more dehydrated than our animal patients are. And because of that dehydration, there's less motion through the joints. There's more gas buildup. And so it makes more noise. But in our animal patients, we don't hear those big noises very often. And when we do, it's quite surprising to everybody for the most part, including me. And so we're going to talk a little bit about what chiropractic really is and how we can think of chiropractic as the continual maintenance of the animal, right? So even though we're talking about older patients, even though we're talking about patients who may not have ever had the experience or the opportunity to have a chiropractic adjustment, we'll talk about what constant maintenance will do to help them. And we'll talk also about how, for instance, the chiropractic adjustment moves and helps that body communicate better with the environment. So in chiropractic, there is a term, and I don't know that I identify it in my talk, but it's called the innate. And different modalities use different terms to talk about the same kind of thing. The innate, the chi, the chakras, things like that. And the way I define it is that the innate is the body's communication with its environment. Every time a cell gets a signal from outside, that cell gets nutrition, which gives it a signal to code for a protein. What does that mean? That's like you getting a call and saying, hey, please send me, you know, whatever product you happen to sell. And so you go and make the product and then you ship it out. Well, the cell does the same thing. It takes the products that it's given and it makes a protein and it ships it out. But every time it does that, so cells are nicer than some people in that they send out also a signal with each protein that says, hey, this is coming. And that's part of that signal that goes out, not just to other cells in the body, but also to the environment itself. That's how we exchange information between bodies. Many of you are probably familiar with the idea that when there are a lot of women working in one office, they all will cycle up together. And that's because they are exchanging that information, those chemical signals. You're also probably familiar with how dogs can be taught to do a lot of things like detect a diabetic crisis or a seizure crisis. And those two are chemical signals that our animals are really attuned to. So one of the things that chiropractic does is it helps these cells to talk better to each other. And when they get a chiropractic adjustment, all of those cells get rid of their waste products. So in our senior patients in particular, we have to be very careful and concerned about who we choose as our chiropractor, because we want to choose a chiropractor who is well trained. We don't want to choose an animal chiropractor who is not a doctor, because they don't have the background, they don't understand the pathology, and they don't understand any of the physiology that goes on in that animal to a degree that will help them make a good assessment of your senior patient. And when that senior patient gets an adjustment, quite often we've got all these cells that have been doing all this work all their lives, and like Dr. Falconer talked about, have built up some inflammation. They've built up inflammatory chemicals that they haven't been able to get rid of. With the chiropractic adjustment, we release a lot of that excess built up inflammation. But if we release it all at the same time, it becomes very toxic to the animal. It can actually make your older animal more ill for a short period of time rather than less. And that's one of the reasons it's so important to find an animal chiropractor who is trained and certified. So we really encourage all of our graduates from our school to take the AVC exam, the American Veterinary Chiropractic Association exam. It is like a board exam, and it helps people to know that that doctor is certified and knows enough to be able to adjust your senior patients in an appropriate manner without, the term we like to say is flushing all the toilets in the house at once. We like to just flush one and then let the septic system recover before we flush the next one. So we're going to talk about that in a way that helps people visualize and understand what chiropractic really is. Because I think for the most population, not many of us have ever seen a brain or a spinal cord, or can even envision what it does. And if you've ever seen one, they don't look like they're doing anything. And so in order to talk about the activities that go on in there, I've used a few analogies in my talk so that our animal owners can get a feel for what it means to get an adjustment. And they'll be able to make a decision about their animals. One of the biggest things that most people have a hard time deciding is, does my animal need a chiropractic adjustment? How do I decide? So in my talk, I will actually talk about one of the exams that we use and something that pet owners can actually do at home. And that is the leg length exam. A leg length exam is non-invasive. It's something you'll be able to see with your own eyes, and it'll help animal owners be able to determine if their pet is due for a chiropractic adjustment. So during the talk, you'll be able to see images and examples of how to do that leg length exam. So you'll be able to go home and examine your own dog and decide if this is appropriate for them.
Very good. Thank you, Amy.
Thank you.
All right. And next up, we have Laurie coming in from Canada. And you are such a great presenter. I follow your blogs that you have all the time, and I've got some from years and years ago in my email because they come back around and they can be so appropriate at a certain time to share with somebody. So tell us a little bit about what your program is going to be for our Senior Pet Summit.
Sure. Okay, so my talk is on novel ways to exercise your senior dog. And my two main giveaways, because everybody knows, well, you can walk your dog, you can do balance, but nobody really thinks about things like power training or high intensity interval training. And these are very novel thought processes, and especially for our dogs, and especially for seniors. So power training is strength plus speed, and high intensity interval training is basically short bouts of high intensity exercise, followed by a much lower level, so a rest, still moving, but a resting stage. And the reason why these are so important for seniors is because this is what we need all the time, we people and the senior dogs. Because if you think power is, if I think of humans, right? A power is, walking up the stairs with your groceries, or reaction time when you're driving a vehicle is a speed, or being able to catch yourself when you start to trip and fall. And while our dogs aren't driving or bringing groceries up, but it's all very much the same. Coming up the stairs is a power activity, or even if it's like squirrel and they go to chase something. I mean, they need to have the mechanisms at hand to do this. One of the things that happens when animals age, people being animals too, is we start to lose our type 2 muscle fibers. And your type 2 muscle fibers are very involved in strength and speed. So these two, power training and high intensity interval training, really target strength and speed. So it will help in that capacity. So I'm going to talk a little bit about how we can do that safely, some fun and easy ways that you can incorporate power or high intensity intervals into your exercise regimen. I'm going to provide a few caveats of when this doesn't apply. So there are a few things, there are some conditions where you really have to think, maybe not. And I always say the caveat is, if you've got big concerns, you're checking with your vet. And then the other thing to note is how much exercise is too much exercise. And so my one little giveaway with that is your animal should never be more sore that evening or the next day, at the end of the next day. A little bit of stiffness is okay, but if that perpetuates, then you've likely done too much. So that's kind of a little bit of a wrap-up gist of what I'm going to be speaking about.
Very good. Thank you all for sharing those introductory informations about each of your programs. All right, so the next part is that we're going to talk about weight and obesity. And so the question is going to be, what are your top 3 things that dog owners or pet parents should consider when trying to get weight off of their senior dog? So what are your top 3 things to consider about weight? Yes. And then why would you pick that? All right, good. So we each have about 5 minutes then for each of those. And I think this time I will start with Dr. Amy.
Well, thank you for asking. I think sometimes one of the biggest things that I see in dogs that perpetuates weight is kind of this vicious cycle. So there's a start with, my animal's not moving very well. And then one of the bigger things that causes some of their weight related issues are long toenails. So keeping those toenails trimmed so that they are not on the floor is very helpful in helping those dogs move better so that they can then keep the weight off, so that they can be more active, and so that their metabolism stays at a better rate. That's not to take away from the fact that I think we will all probably agree that a proper, a natural diet is going to be one of the important things that helps those animals' metabolisms stay in a more normal range. So that's where I would start, is motion, toenails, and diet.
Motion, toenails, and what was the last one?
And diet.
And diet. Okay, very good. All righty, next, Laurie, I'm going to ask you, what would be your top 3 things that you would share with a pet parent regarding weight or obesity?
Fabulous. Okay, so I'm going to tag on to the movement component. So definitely sometimes it's just a matter of get them moving a little bit more, a little bit doing something a little bit extra. So just to increase the movement. Number 2 is, we'll call it the treat jar, in which case I had a client bring this up and they said to figure out how much they were actually, it was her parents, were actually giving the dog as treats, is she said, every time you give a treat, give 1 to the dog, put 1 in a jar. So that at the end of the day, she actually knew how many treats her parents were giving the dog, and it was far more than anybody expected. So then that helps then to factor in is to actually count the calories, to figure out how much this dog is actually eating. So you'll likely need someone to help you. There are some good websites, but likely your veterinarian, or there's, like I said, there's websites that can help you actually look at, this is how many calories are in a milk bone or a miniature carrot, and actually look at how much the dog is eating, because I think that's where you go, it's more than you're thinking. So that's my 3. Oh, 4,
okay.
3.
Very good. All right, next, Dr. Will, what would be your top 3 points that you would want to share with the pet parents regarding weight and obesity?
My number 1 is diet related, and it's carb avoidance. I've been studying insulin resistance, which is, if you haven't looked that word up, do. It's a very interesting subject, and we're probably all suffering from it. But back to the wolf, wolves don't eat grains or starches, which, by the way, all your grain-free, quote unquote, kibbles have starch to hold them together. It's by definition, they're starchy. And simple carbs push dogs and people into this thing called insulin resistance. And that's a sure formula to push fat into more deposition and to grow fat cells. Second is regular fasting, which every wolf would do on a regular basis. So we can mimic this, right? Prey isn't at their beck and call. We can mimic this with a day a week of fasting, regardless of age or breed or weight. A dog can miss his meals on, say, Thursday of every week, and just have broth, nice warm broth, whether it's bone broth or veggie broth or meat broth, just nothing solid for that day. Do other things to love them and play with them and get them out and all that sort of thing, but no food, no solid food. And the third is exercise, as we've already touched on. But what does a wolf do all day long? They're on the move, right? They're not sedentary. They have to hunt in order to eat. So we can mimic that in any number of ways. I'd like the sound of high intensity interval training. That sounds pretty cool. And just get these animals moving on a regular basis. Again, mimicking what we know the wild ancestors and cousins do, you'll always be in good shape.
Thank you, Will. That's really good. I was envisioning my dog on the first time that she has to take her Thursday only liquid fast. She's gonna think something's wrong with me. Mom, you must be thick. All right, Dr. Pj, your
No,
3
I'm not
points.
sure I can come up with anything more brilliant than what they have talked about. I will say that the only thing that has level 1 evidence for longevity is weight restriction. And they did the studies, the split litter studies in Labradors. The dogs that were fed to a thin weight lived 2 to 3 years longer, which is a substantial amount of time. The interesting thing is, well, I did a study on this a couple of years ago, and they said that no matter when you start calorie restriction, you can actually gain 20 to 30% more life from that time point on. Whatever age you have left, you can tack on another 20 to 30%, which is pretty significant. That's, not in the face of not having cancer or something like that. So to mention something that Will had talked about in his initial presentation, over vaccination. They've actually associated thyroid disease with vaccinosis, primarily rabies vaccine, but we see an inordinate number of thyroid dogs. So, that's one of those vaccinate, the core vaccines. What are their risk factors, and what is the actual duration of immunity before you vaccinate? Because I think that's a big factor. So limiting vaccinations is one. I like the intermittent fasting, also feeding once a day. Instead of you can't leave food down. Most animals are not good grazers, so especially cats. And because those, if you leave it down, it's probably carb loaded, and cats are obligate protein eaters. They just don't do carbs at all. They shouldn't do carbs at all. So feeding once a day. When we do the one day a week fast, we have the people make bone broth ice cubes, so they're actually getting something that is crunchy to chew on, and most dogs like ice cubes, so that gives them something they actually feel like they're eating something even if they're not. So, and I'm not sure what the third would be. It's the diet thing is huge. I've been working on those kind of theories, more like of the feeding for origin. So if the dog is a northern breed, they didn't eat they didn't eat grain. There's no grain up there. A lot of those dogs end up with autoimmune diseases in the skin and stuff that are because of they're not eating foods that they're supposed to be eating, like huskies and some of those you'll see like zinc responsive dermatoses on those. I will say though, however, that the little Asian dogs, they sat in people's laps and they ate what the people ate, and that's a little bit of fish, a little bit of pork, and lots of fruits and vegetables, a little bit of rice. So, and if the people will feed those dogs like that, we almost never see those dogs come in atopic down the road, because they actually have the enzymes. They have developed the enzymes to digest the foods from where they came. So if they, it's like people, Maasai Indian or Africans can drink milk. Of course, they drink it raw with blood, which sounds not very good to me, but none of the most of the other African tribes can't drink milk. They don't have lactase because it was never in their diet. If you're Dutch, however, you probably have the enzymes to digest milk, and milk is actually medicinal for people who can, and that's an A1, A2 thing again. So, that's another big rabbit hole. But so sometimes it helps to look at what's appropriate for how did they develop alongside of people? What did they eat? So that can be useful too. But the big thing is the carb loading. Even the Chinese who eat rice, they eat it at the end of their meal. They kind of fill up with it at the end. They're not eating a bunch of rice. So, the carbs they're getting is a topper. It's not the main part of their meal. So those are things to consider. But yeah, we need to be, it's a lot easier to keep them from getting overweight than it is to take it off of them. And a lot of these dogs are spayed and neutered early. That seems to be the fashion now. And it changes their hormones. So if you can hold off till they're a little bit older and have full growth, that may be one too many points there, but sometimes that, there's a lot more data coming out about the, appropriateness of early spay and neuter. So that can be a factor.
Listening to you there reminded me how I always enjoy visiting with you, because you have one of those minds that remembers the study, the research, who the authors were on this. And it just like that always amazes me that you keep track of all that. And it's fun to talk to you because you always get back to that. Here's where it came from. And that's way cool.
That's why Rick Palmquist calls me the librarian.
Yeah. That's good. Way cool. All righty. Thank you all for that. That was great. So the next part of our kickoff party tonight is that we wanted a case. So I thought, okay, what's something that we see in our seniors? So this dog is going to come to visit you. And the question is, how would you treat, he's a diabetic, neutered, male Labrador. It's a Labrador mix. So you can envision this big old guy, coming in. Oh, okay. So we're going to do can you see that message? They'll do a cut and splice here. There's still a lot of rattle when you talk,
sorry.
PJ. So it sounds like it's like wind, like when wind's coming past something.
I don't think it'd be I've got a fan on in here, but I don't think it'd be that.
No, you hear it when you're talking. It'll kind of.
Okay, it's probably because I talk with my hands and I'm moving.
Okay.
Apologize. I'll move it. I'll hold on to it. Maybe it may be rubbing on my shirt or something.
You sound good right now.
Sounds better. Yep.
Okay, good. All righty. So
if I hold on to it, then I can't talk with my hands, and I can't talk without my hands.
Then you
so
can't,
what am I going to do?
So
I think it was your fan.
So,
I think it was the fan.
You think it was the fan?
Yeah.
Maybe. Okay. Well, that would be a lot better because then I could talk with my hands. Okay.
Very good. Okay, so we've got a male Labrador mix who's a diabetic. He's also been neutered, and he's, that middle age to moving on up. And this dog is presented to you with stiffness and arthritis, but he's very happy and he's very friendly. So you've got this case, middle age to up, neutered male Labrador mixed dog that's also a diabetic, and he's got stiffness and arthritis, and that's why they've come to you. So I'm going to start with Laurie. See what you want to help this old fella do.
Oh, so there's
How would you approach him in that scenario? And then why would you do the things that you're going to recommend?
okay, perfect. So there's two different trains of thought here. And I actually was taking all sorts of notes before I got notes on all the things. Because when I look at this, there's the two components, and one is the diabetic component and the other is the stiffness and the arthritis component. So if we go with diabetic first, it's going to be, we're going to want to make sure that they are in check with their veterinarian, and if they're going to start some sort of exercise and keep their dog moving, we just want to make sure that everything is in check, that however they're managing their diabetes is in check before starting some sort of an exercise, especially if they're inactive or if it's a new diagnosis. Exercise is good in that it can decrease blood glucose and boost insulin sensitivity, but we don't want to overdo it in these cases. So we want to start slow. And typically for a diabetic to exercise, we would add aerobics. And what we say in the human side is it should be every day, whether that's just walking, no less than every third day. So we want something regular. Balance exercises can be good. And that could just be, I call it around the world, lift a leg and balance, lift another leg and balance, lift another leg, not one at a time, not all four at once. in case that gets confusing. Weight training is something else we do with people. So we can do this again, walking hills, walking stairs can be well. And again, if this is a new diagnosis and the dog is now newly exercising, it might be something that if the exercise and this is not yet a managed diabetic case, in people, low blood sugar can look like a person is wobbly or dizzy or confused or shaky or weak. So it might be something for the owner to know and have something in their pocket that they can feed the dog on the way. Now that's the diabetic component, but the stiffness and the arthritis component, as the physical therapist, I'm like, ooh, lots there. So you don't say where they're stiff. So full body evaluation, see how all the joints move, flexibility, feeling what is sore, which muscles are sore in combination with which joints are stiff. And then there are so many things from a physiotherapy perspective for pain, and whether that is the modalities like laser or shockwave, whether it would be something like acupuncture or all of the above that can help with that. Water therapy is great, exercising with swimming, underwater treadmill, any of that. And if they're stiff and sore, short bouts of exercise multiple times might be better than a big, long 40-minute walk. And lastly, for me, home program is key. So there's likely lots that I can show that owner to do, whether it's some home manual therapies like massage, range of motion, stretching, just different things like that they can do to manage that dog as well. So there we go. My brain is just ping, 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 ping.
That's awesome. And I think that's our group, our audience for this program too, are people who want to have something to take home and do at home. Yeah. They're not just, okay, you give me this and then that's all there is to it. They want to be included in this process of, yeah. So you're able to offer that to them. Thank you, Laurie.
Thanks.
All right, next up, Dr. Amy, what are you going to do with this middle-aged, neutered Labrador mixed dog that's diabetic, stiff, and arthritic?
Oh, I was hoping you would talk with Dr. Falconer first, but anyway, because then I could follow up on what he was saying. When these dogs come to our clinic, we do kind of the same. We have kind of a similar a protocol that we run through. One of the first things we do is look at the motion between their head and their and their legs. We look at a leg length exam because we're going to assess, is that spine moving like it should be? And if it's not, we want to help it move. One of the things that contributes to changes in metabolism is everything that's going on in between the head and the neck. So if we were to take this dog, and we wouldn't do that, but dissect it out and look at, when we cut the head off, all the things that are sitting in that space include the thyroid, the pituitary, the thalamus, the hypothalamus, the brainstem. All of these are elements of the immune function of the dog, but they're also going to have a lot to do with metabolism, which are going to have an effect on pancreas. They're going to have an effect on GI tract. They're going to have, so that feedback loop, by feedback loop, the communication between the brain and the gut, which is what really sets them up for diabetes. So we're going to take a look at that part of the spine to see that it's moving appropriately. And if it's not, we're going to adjust it so that it is moving appropriately. And because it's an older dog, that may be all we do, because we want this dog to be able to rebalance itself a little bit before we do anything further. On the second visit, which might be in a couple of days, it might not be in a long time, but it'll be in a few days, we would take another look at the dog and see how the dog itself has processed all of that. We see these guys, I have to say, on a pretty regular basis. And I'll tell you, I've had this conversation with an older Labrador owner, and the dog literally, she would get the dog out of the car, put it in a wagon, and wagon it into the clinic, and then ask us to work on the dog. And with my experience with these particular cases is that if the owner is unwilling to make a significant change in their diet, and it has more to do with, I think, being the Labrador than anything else, because different breeds respond differently to treatments. If this was a Chihuahua, it'd be a way different scenario. But in our Labrador patients, if they're not willing to make a change to a raw diet, we can adjust them all day long. They're not going to make a significant shift in their metabolism. When owners are feeding that dry, hard kibble every day, we think of it like taking them to McDonald's. And we all know the science behind the McDonald's hamburger that sits on the windowsill for 42 years and doesn't change. And we explain to them that kibble is basically that same hamburger. And it makes the dog, it increases that dog's inflammatory component, but it also shifts their metabolism. And so one of the biggest components is to get the owner to understand that changing that dog's metabolism comes at home in their diet. And we like to help them in the most simple way possible. And so we usually recommend a commercial raw diet, because all they have to do is order it, it shows up, and they can feed it according to the package. For some of those owners, that is the best way, because they liked the kibble because kibble is convenient. And so shifting them to a commercial raw is one of the most convenient ways. There are other owners, though, who are going to want more, hands-on. I want to make my own food. And so for those owners, we caution them that they have to make sure that they have a recipe that is balanced, that contains organ meats, that contains bone, that contains skeletal muscle, and some vegetables, because those are the components that make up that balanced diet for a dog. So kind of comes back to diet, and then routine chiropractic care, because we want to be able to continue to help that part of the nervous system to have a good communication with the rest of the body. And the third component, which I think I said this earlier, that we always look at are toenails. And I've even had other veterinarians say to me, how can toenails change the metabolism of my dog? But the nervous system has two parts. It has the sympathetic part, which is the run and fright and flight or stress. And any animal that's in constant stress. So as an example, if you were under immediate duress, say something very frightening happened and you had to run out of your house. If we drew blood right at that moment, you would look like a diabetic. But in an hour or so after that stress, that would all quiet down. When those animals are in constant daily stress from long toenails, which make the animal not be able to use the muscles that help them stand up more efficiently, it makes them use the muscles that help them run to stand up. So when that happens, it shifts their nervous system from being a balanced nervous system to being more fight and flight all the time, which throws them into that diabetic situation. So quite often, trimming those toenails can do a huge favor to that dog and help them to decrease their sympathetic tone, make them less in the flight part of their system, and bring up the part of the nervous system that helps them to balance their metabolism. So those three things: diet, chiropractic, and toenails.
Very good. Thank you, Dr. Amy. Okay, Dr. PJ, you're up.
Oh,
Are
I
you
don't
gonna-
have to go last this time and come up with something different?
Will's going to
Okay.
be last this time.
Okay,
Yeah,
well-
so what would you do with this middle-aged Labrador that's diabetic, arthritic, and stiff?
So kind of touch a little bit on what Amy said, a couple of things actually. One, the sympathetic dominance and stress. Stress also, whether it's endogenous cortisol or exogenous cortisol, increases leaky gut, which also increases flooding on the system. People that are under stress, their diabetes is always worse when they're under stress. So that's kind of an interesting thing. The other thing is what usually gets left out of the diabetic equation, at least we don't look at it in medicine, is that diabetes actually lives in the mesenchymal space, in the matrix. That is, those are glycans that make up the framework of the matrix. And it likes sugar. It's sugar, it likes sugar, it sucks up sugar. So, you know, when you eat a high carb diet, the sugars go up, the insulin chases it, and then it takes more and more insulin as you stack more sugar. That's that glycosylation of the matrix of the mesenchyme. It takes more insulin to push that sugar across the space, but it's stacking in that space. It's basically, that they call it glycation end products, but it's stacking in that space. So then you've got a low blood sugar. So you start, then you're hungry again. So you get that kind of vicious up and down hunger, going to the refrigerator or whatever, eating too much because you're constantly chasing that sugar into the mesenchymal space. Frequently the cells aren't getting it, but it's stacking up in the mesenchyme. The hormone, when you made that comment about the thyroids, Amy, the thyroid hormone balances the mesenchymal space. And then to go back to what Will said, mercury makes the matrix rigid. Zinc balances it. It will thin the tissues and make it and balance that tissue. That's one of the reasons zinc is sometimes useful for diabetics. The other thing is that because it's a mesenchymal issue, there are two things that have been studied fairly extensively. One is alpha lipoic acid. Alpha lipoic acid is it's the only substance I've seen that has both a lipophilic and a hydrophilic, and so it's got a fat and a water component to it. And it's thought to facilitate the movement of insulin and glucose through the cell walls. So the other thing that can be helpful is a complex homeopathic called Lymphoma Salt. It's what it says it is. It's a lymph mover. So they actually did some studies with Lymphoma Salt and alpha lipoic acid, and they reduced diabetic neuropathy in humans. So which is a late stage diabetic issue, because you've got edema, fluid out in the tissues that's compressing the nerves. So if you can actually move that, and the first dog we ever put on that years ago was a diabetic, came to us. It was on vast amounts of insulin. Part of the reason is the insulin's trying to chase that into a space that's stacked up with sugar. When we put him on the Lymphoma Salt and alpha lipoic acid, his blood sugars went up, and I went, oh my gosh, that was before I realized had learned that it was a matrix issue. But he was clearing the coffee tables and running and playing. I mean, he felt great. This was a dog who hadn't been feeling good, and he felt great on those. So his cells were obviously getting fed, but that sugar had to go somewhere. It's got to come out. You've got to pee it out. That's the only way. You've got to get rid of it. So that's just something to kind of consider if you're dealing with a diabetic. And as far as that's kind of one of those vicious circles of things. Those dogs are overweight. They're sore. They're not moving. So they're not moving the matrix. They're stacking the sugar up out there. So the movement, exercise, passive water therapies, hydrotherapies, anything to move the mesenchymal space, to move the trash out of there, can be really, really useful. And for a while there, they were saying, you shouldn't use glucosamine because it could make diabetics worse. But I think that has actually been, that's not the case. The studies haven't borne that out. The thing that changed the way I practice medicine about 40 years ago was Glycoflex, which is Perna, and it's 9 glycosaminoglycans, and that and the deer antler are probably the two primary things that we use for the musculoskeletal stuff. And that we had dogs that couldn't get up, literally couldn't get up, and they were the next step was euthanasia. And when we first started using the Perna, it was like it just blew us away. So, we have used those kinds of, there are supplements that can be remarkably useful to get these animals up and moving again. If you don't get them moving, they're not going to move the sugar out of that space. So that's a critical, those are critical points for diabetics. So.
Very good. Thank you for that. All right, Dr. Will, it's up to you to share how you would approach this good old boy.
Well, you're talking to a classical homeopathic vet here. So what we're going to do is focus on the whole dog. And in classical homeopathy, it means often spending an hour with the owner, getting all the details about this guy. Yeah, we know he's diabetic. That's a diagnosis. We know he's sore. What does that soreness look like? What makes that soreness better or worse? Is it worse when he first gets up and it's better as he moves, et cetera? All those questions come up. But beyond that, we're going to look at things like, unrelated to all those things. What are his teeth like? What are his behaviors like? Is he afraid of the dark? Is he, thunderphobic? How's his stool? How's his urination habit? All that stuff, because we're looking for remedies that treat the whole dog. And the goal is, in classical homeopathy, we give remedies one at a time to prompt a healing response from within. So we're triggering his vital force, same as the innate, as mentioned earlier. We're triggering his vital force to say, hey, we've been fighting this disease for a long time, these diseases by name, and let's get the fight turned up and finished. Let's not stretch it out any longer. So is it bad breath? Is it waxy ears? What do you got in this dog besides, yes, he's lame and he's got diabetes? So when the whole dog is treated this way, we expect everything to get better. And it's a process. It's not do it yourself, one remedy fits all. It's a very individuated process. So it's hiring a professional to take you on and do that with you. And we would never do this without diet manipulation as well. A good homeopathic vet is always asking, what's he eating? And changing that around, as we've spoken of, had some great tips already from the others, is that get him on something that's not carb laden, get him on a good fresh raw diet that's balanced, and support that effort by him to get over his illnesses and throw them off. Keep touch with the insulin levels, because as he gets healthier, he's going to need less and less, right? So we want to keep monitoring that and ratchet it down as he's getting better. And at home, that's on you, right? That's what you can do. You are the diet provider, and you can get further educated on that. And as mentioned, get, just a commercial raw food to start with if you don't want to get involved in making it. But get off the carb-laden kibble. Your big job also for the homeopathic vet to do his or her work well is keeping a log, a diary of symptoms. We've got a list of these symptoms. He's got bad breath. He's got lameness that's worse when he first gets going. And he's overweight. Put him across the scale every week and see how that's coming. How is the bad breath done? When we give a remedy, we're going to come back to you a few weeks later usually and say, let's go through your list. How have things done? Well, this got better, that got better. This new thing popped up. Well, it's not really new. I saw it, back when he was a 5-year-old, but I forgot to tell you about it. Oh, okay. Tell me more about that. So it's a process, and we'll use one remedy at a time, evaluated carefully before we decide on the next remedy for your individual dog. And the outcome is often very, very pleasant. Everything clears up when we're doing our job right. So that's what I would be doing. And in 5 minutes or less, classical homeopathy is a really powerful way to get those guys on the move.
Very good. Thank you all. Those were awesome contributions for helping this old guy. And I had picked that topic because that wasn't one that really came up in a lot of the presentations that we're going to be having. So I thought that made this evening be a little unique and brought out this diabetic patient and the different ways that it can be approached and helped aside from just the insulin. So this was awesome. I applaud you all. That was great. All righty. So let's see here.
While you're looking, I was going to make a comment. We had a grossly overweight Labrador years ago that we took part of her food up. This was before I knew much about raw and all that. And we fed her broccoli, steamed broccoli. We picked up some of her food, which I think really in the long run was probably helping to support her thyroids. So she lost like 30 pounds and looked absolutely fabulous. So, that's something you can do at home. It's some of the things like the crucifers, if you look at the nutrients that are in the nutrient dense foods, they can be remarkably helpful.
Very good. Broccoli. Wonderful green.
She liked it. She liked broccoli.
All right. So our last part of our kickoff for the Senior Dog Summit is in thinking about the diligence of taking care of the senior. What is one tip? Each of you are going to give us one tip that you would like to share with the pet parents that are listening to us, listening with us tonight. So what is one tip? So let's see, who hasn't been first? Amy, you haven't been first. PJ hasn't been first. Okay, PJ, kick it off.
Prevention. If you want them to live good quality, to a good quality of life, good quantity of life, it's prevention. You've got to minimize the toxins, you've got to maximize the nutrients, and you've got to keep them in motion.
Awesome. Prevention. Very good. Dr. Will, what would be one thing you would like to share with the seniors?
I'll second that. The prevention has to be done in a non-conventional way, though. So what we're seeing is chronic illness as a result of conventional prevention overdone, right? Yeah. Too many vaccines, junk food coming off the vet's shelf, and toxins for everything. Kill the ticks, kill the fleas, kill the heartworm. So I'll second PJ's point, start early, but you can do a whale of a lot of good even starting later in life, just getting off of that wrong stuff.
Very good. All right. Laurie, what would be your one point?
I'm going to say keep your old dog active. So exercise smart. So a little bit can go a long way if you're choosing smart exercises to keep them moving.
Very good. Thank you. And Dr. Amy, what is your final tip or takeaway point?
My final tip is going to be, don't be afraid to get started with them, even though they're older. They can't get better if you wait. So it's never too late, really, if they're still able to move, if they're still able to do some of those things that we've talked about. But better to start them sooner with a little bit than to not start them at all.
Very good. All right. So this has been a wonderful pre-senior summit kickoff. I think we've shared some awesome ideas, and the audience will have an opportunity to get themselves jazzed up to be ready for the summit that's coming ahead. So we appreciate the audience tonight. I appreciate all of you for giving your time up to be able to be a part of this panel and enjoy this little evening party. And we're just excited for this summit to get started, and we're inviting everyone. You invite your friends, your neighbors, anybody with an animal, anybody thinking about getting animals, all the audience out there. Just take this opportunity to learn from some fabulous speakers, educators, presenters from all walks of life in this arena of caring for these seniors. And that is the thing I think that you will find that permeates throughout every presentation, is that our hearts are there for these old ones, that we love taking care of these old guys and old gals and seeing them get better. I mean, it just makes your day when you can see them become younger and enjoy life and have a good time again. So in ending off, again, thank you all for being here and being a part of the Pet Summit. And we look forward to what it's got in store over the next few days.
Thanks for inviting us.
Thanks very much.
Thanks for having us.
Yeah, it was really fun.